What I came to realize after the first 18 years of my career or so was in GE all over the world, as I dug in more to the healthcare space, I mean, cardiologists can pretty much fix anything now.
Yeah.
If you find it, it's not like cancer, it's not like Alzheimer's where there's an element of mystery remaining. But my grandpa's experience of being in and out of the hospital, which he would probably view as a miracle, because every time he's in the ER, he leaves either with a pacemaker working 100% or whatever it was, could have been completely prevented. If you would have just detected heart failure as an example, or aortic stenosis as an example, early enough. So everything we're doing is trying to get really, really inexpensive and remote ways to detect heart disease, knowing that if we can fix that piece, there's a million other brilliant cardiologists that know how to go treat it and fix it, but we've got to go find it first.
Got it.
Yeah, I think there's a couple layers of rural health that's tricky. I mean, especially in cardiology, it's hard to incentivize somebody who just spent 15 years going through school and $600,000 to go set up shop in Springfield, Kentucky.
Right.
I don't blame him or her for saying I want to be in New York City, or I want to be in Chicago, or I want to be in Lexington, as an example. So I don't think we'll solve that soon. And believe it or not, I mean, there's less and less people trying to become cardiologists, which is a different problem. So how do you go and save
Okay.
people retiring from getting burned out? I think
if we didn't charge them $600,000 to get there, maybe that would change.
that's exactly right. So I think there are some structural incentives that could exist that we need. Think about it as kind of like a subset of broader heart disease. And there's about 1 million people every year that get diagnosed with heart failure. So in the case that I described, like 800,000 of those they're finding in the ER. And although hard to measure, there's been a few studies that would estimate upwards of 40 million Americans have asymptomatic heart failure today. So they're walking around and don't know it.
Wow.
So they're heading down, which could be 5 years, it could be 7 years away.
Okay.
This is kind of stage C, and that's when you end up in the hospital. So it's pretty rampant.
Yeah, yeah. I feel like too, for women particularly, like heart disease is one of those things that goes far, like very undetected in women.
Yeah. Because more often than not, let's say a guy who's 55 years old comes in with a chest strain from lifting weights, for sure gets admitted as a potential heart problem and gets the full gamut of tests. And then a woman comes in 20 minutes later saying, they're feeling the same strain, and then they're like sent home with stress. Like, you're just stressed. Like, this is not necessarily. It is more common for men than women, but very quickly, and maybe the woman who comes in doesn't say, no, like, let's do the full workup. It's like, okay, stress, you're right. It has been stressful. They get sent away, which is a travesty. So if you get, like, very quickly, and in both cases, you don't want to go do tens of thousands of dollars of tests if you can avoid it. But if you had a tool like this that you could sit there and put it on, and what we're looking for, you're right, does differ between men and women. I mean, even pre and post menopause, things change a little bit. So everything we do, and Google, we use GCP for a lot of our cloud compute, is all exceptionally secure. So the data is going straight from our device, and it's sitting in all kind of HIPAA secure containers that we do everything on. Believe it or not, our models that they exist actually take no inputs on like patient metadata. So we don't take in age or sex or medical history. We get all that context on the patient directly from the ECG, which is where some of the interesting AI comes in. And most of the AI we use today, there's a lot of companies that use like these deep learning concepts where you're just throwing like terabytes of data into a machine, and then they find interesting correlations that may or may not hold up in the real world. I would characterize ours a little bit more on the machine learning kind of Roomba-esque type view, where we're looking for very specific things based on all this research that we've pulled. So it's important to us to be able to explain to a cardiologist what we found.
Yep. AI is not going to do everything like they say it's going to, but there are some things that it's going to be extremely useful for forever. It's very good for something.
I completely agree. I think our view is that or at least my view rather, is doctors are not going to get replaced, but they're going to have a lot of super tools at their hands that they didn't in the past. But there's still such a human element of being a doctor and understanding context of the patient and history of the patient and tone and how they answer questions and nuance. And that I think is not easily replaced. But if you can have that doctor like seeing the right patients or seeing more patients or seeing patients at home, as opposed to having people drive, I think they're going to remain critical to the entire system, but will be super powered over the next.
Yeah.
It's mentioned it earlier. It's like Star Trek. Like it's literally becoming that, where they just stick a device on you or just wave something over you and they know exactly what's going on. But you still need the doctor to implement the things and to talk to the patient and make sure they're okay. Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube and Patreon, patreon.com/healthcareuprising, if you want to watch us in action.
You can also find us on social media on LinkedIn, Blue Sky, Instagram, and Facebook. Just search Healthcare Uprising to find us. And if you're a new company or a creator with a cool new product for the healthcare space, or if you're someone with a personal healthcare journey and you'd like to share it with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. That's all for this dose of Healthcare Uprising. Till the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.